Hi, I'm Allison Pepper. I'm a licensed clinical social worker here in New York City.
And I'm Heather Coleman. I'm also a licensed clinical social worker practicing in New York City. And Alice and I are both a part of a practice in New York called Buddhist Psychotherapy New York. And today we are taking the opportunity to talk about why bother going to therapy.
Why bother?
Why bother?
It's a good question, and we bring it up because people bring it up, right? People call us, they're thinking about coming, they want to come, they want to check in with us, what is therapy all about? And, there's obviously a lot of reasons to go to therapy, but I think one that really drives me to go to therapy, both as a therapist and as a client, is getting to know myself, right? Doing more internal work, getting to know who we are so that we can be the best versions of ourselves, so that we can gain insight, gain awareness, and use that insight and use that awareness to be our most whole selves.
Yeah, and I'd actually agree with that and add just a little bit that when people come into this room, they often start to find, once they start talking, that they've been acting out of a place of habitual patterns, and they really have developed this idea that that's who they are as people. I am what I think, what I feel, and how I act, and we get into the habitual patterns of thinking, feeling, and acting. And then once you start to notice how habitual they are and how automatic, and that we've internalized these beliefs and messages over the course of our lifetime, we start to notice, oh my goodness, maybe this isn't who I actually am. And so in therapy, hopefully you can tap in to more and more internal resources, more and more parts of yourself that have gone hidden or underground, and to discover new ways of thinking, feeling, and acting, and you get to actually practice that in session with another person and experiment.
Yes. I think another way that we can find coming to therapy beneficial, is if we're really struggling in our lives, and everyone's going to go through something at some point. We're going to deal with loss, grief, transitions, surprises, as well as health and mental health concerns, right? So whether you're dealing with chronic illness or, years of anxiety or depression, it's not easy to go through that alone. And sometimes the therapy space can be the place where someone can be most seen, most heard, most understood in a time when maybe they feel completely out of control or at a loss. And that's just something to keep in mind and something to think about for you or people you love, that yes, therapy is a place to go to really get support.
Yeah, and I just want to piggyback on that a little bit, is that I think we often get the question of, well, why would I bother going to therapy if I could just do this with a friend? I can have the same kind of conversations.
Right.
I can just go down the block and sit at a bar, hash it out with somebody.
Why pay Heather?
Why pay us? Well, those are lovely relationships to have, and I definitely think having social support is really important, having people
Yes.
who care about you and get you. And at the same time, the therapeutic relationship is a lot different in the sense of, hopefully we're experts in our field, and we bring expertise to the table about psychological issues and the underpinnings of those, and trauma, and how to work with trauma in a creative and actually practical sort of way. And over time of really developing this relationship with someone, hopefully you feel more and more safe with someone in the consistency and being seen and heard and supported, that then you start to say, oh, maybe I can can reveal more and more to this person. And whereas in other relationships, maybe you didn't feel safe enough to do that, or you felt shame or embarrassment around something that you felt was abnormal or that there was something wrong with you. And here, there's more and more access to that information so that we can really both take a look at it together and go, well, is that actually the case here? And let's explore this together and let's see where things go. And so this relationship is one that, hopefully over time becomes hopefully one of the most safe relationships you have in your life.
Yeah, it's a unique space, right? The therapy space, the office, the relationship that you have with your therapist, and a lot can happen there. A lot of growth and understanding. So that's what we got for today. Stay tuned.
We'll be talking about more and more topics over time, so definitely come back and visit us.
Thanks.
Thanks.